Hi, this is Dr. Fox, and let's talk about the larynx. In this video, we'll describe the structure of the larynx, the structure of the laryngoskeleton, the airway, and any relevant neurovasculature. So the larynx, or colloquially the voice box, is the cartilaginous structure that hangs inferiorly from the hyoid bone. Recall the hyoid sits at about the C4 level of the C-spine, and so the larynx may be found between the C4 and C6 vertebrae region of the C-spine. It's anterior to an important part of the pharynx known as the laryngopharynx. If you may recall from the previous video, it's at this point materials may either enter the respiratory system or the larynx or continue on to the digestive system via the esophagus. The larynx is sitting atop or proximal to the trachea. The trachea is the pathway that is between the larynx and the primary bronchi of the conductive portion of the airway. The larynx has its major structural support complements of the laryngoskeleton. The laryngoskeleton are several hyaline cartilage elements that come together to give structure to the larynx. They consist of a thyroid cartilage, so here we can see it in lateral view, here in posterior view, a cricoid cartilage that the thyroid cartilage sits atop, and arytenoid cartilages. The arytenoid cartilages sit atop the cricoid cartilage, and the epiglottic cartilage that articulates with the thyroid cartilage. There are several other minor cartilages that are beyond the scope of this primer. So let's take a look at some of the elements of the laryngoskeleton. Let's start with those of the thyroid cartilage. So the thyroid cartilage consists of two laminae, or plates, that come together along the midline. The superior portion of where the laminae come together is a region known as the laryngeal prominence, also known as the Adam's apple, which one might see grossly visible in the anterior neck. There are also horns, both superior horns that articulate with the hyoid bone and inferior horns which articulate with the cricoid cartilage. And this is going to form a cricothyroid joint. So the laryngoskeleton is somewhat mobile or kinetic. The thyroid cartilage is incomplete posteriorly, so we can see here in this posterior view there is no thyroid cartilage obstructing our view of some of the other cartilages, but we do get to see the cricoid cartilage, and we can see the relationship of the cricoid and thyroid cartilage at that cricothyroid joint. The cricoid cartilage, krikios means ring, is the only element of the laryngoskeleton that completely encircles the airway. And sitting atop the cricoid cartilage are the arytenoid cartilages. These arytenoid cartilages are the most kinetic portions of the laryngoskeleton. Here we can see in a superior view the relationship of the arytenoid cartilages to the vocal ligaments, which span between the vocal processes of the arytenoid cartilages and the thyroid cartilage. There are also muscular processes on the arytenoid cartilages that can allow intrinsic muscles of the larynx to attach to move the arytenoid cartilages around. These are attachment sites for those intrinsic laryngeal muscles. Now, the vocal ligaments are going to be invested by mucosa, and so we will call these the vocal folds when they are invested by mucosa, and oftentimes we refer to them as the vocal cords in the individual. So these are the structures that vibrate during phonation. And then finally, we have the epiglottic cartilage. The epiglottic cartilage, when invested with mucosa, is known as the epiglottis, and that is going to articulate with the thyroid cartilage. And so this is going to form a large portion of the laryngeal inlet. That's that space through which air may move between the inside of the larynx and the laryngopharynx. Let's take a look at that space now. So we've incised the larynx and reflected it on either side to show what is internal here. So let's erase that. And we can see some folds. So there are vocal folds. Recall the vocal ligaments run between the arytenoid cartilage and the thyroid cartilage. Those are the folds that vibrate for phonation. Superior or proximal to those, there are also vestibular folds that run between the arytenoid cartilage and the thyroid cartilage. These are also known as false vocal folds. But they can vibrate. So if you've ever heard of throat singing, that sound is complements of the vestibular folds. Between the vestibular and vocal folds, we have an area known as the laryngeal ventricle. So that is just a empty space there. And then inferior from the vocal folds, we have the median cricothyroid ligament. That median cricothyroid ligament is visible in the anterior neck. You can palpate it. If you put your finger on your laryngeal prominence and then just move inferiorly, you can feel a divot between that and the next firm, palpable structure. That divot is the median cricothyroid ligament, and that is what may be incised along with the skin superficial to it during a procedure known as a cricothyrotomy. A cricothyrotomy is an emergent procedure to gain access to the airway if there is a proximal obstruction to it. What's good about a cricothyrotomy is that there are palpable landmarks, the laryngeal prominence superior to it and the cricoid cartilage inferior to it, and there are no vascular issues or vessels that one might come across in incising that area like they would during a tracheostomy. Let's take a look at some of the neurovasculature that serves the larynx. In terms of the nerves, it's cranial nerve 10, the vagus all day, and there are two nerves that we want to look at, the superior laryngeal nerve and the recurrent laryngeal nerve. We'll have a set of these on either side. The superior laryngeal nerve branches from the vagus high in the carotid sheath, and it descends, and there's an external branch that goes through the thyrohyoid membrane. I'm sorry, that's an internal branch, and an external branch that continues down to serve the cricothyroid muscle. So the superior laryngeal nerve is efferent to the cricothyroid muscle, and it is afferent from and secretomotor to the mucosa proximal or superior to the vocal folds. Whereas the recurrent laryngeal nerve will exit vagus and on the left side wrap around the concavity of the aorta, or on the right side wrap around the right subclavian artery, and then either of these sides will ascend the neck in the tracheoesophageal groove adjacent to the inferior laryngeal artery, where it continues on to innervate all other intrinsic laryngeal muscles, so everything with the exception of the cricothyroid muscle. And the recurrent laryngeal nerves are afferent from and secretomotor to the mucosa distal or inferior to the vocal folds. So that covers the innervation. Let's take a look at the blood supply. The blood supply comes from the superior and inferior laryngeal arteries. The superior laryngeal artery is a branch of the superior thyroid artery. So here we see the superior thyroid artery descending the pharynx, and then we have the superior laryngeal artery that accompanies the internal branch of the superior laryngeal nerve through the thyrohyoid membrane. And then we have the inferior laryngeal artery that is coming up from the thyrohyoid trunk, which is a branch of the first part of the subclavian artery, to provide blood to the larynx from below. So we've discussed the larynx, where it's found, its constituencies, its innervation, and its blood supply, as well as how to gain emergent access to the airway through a cricothyrotomy. This is your summary slide. Thank you for your time.